Remember, your final outcome with cataract surgery depends on the health of your eye, it depends on the health of your retina, and it depends on how that lens sits and behaves in your eye. None of the lenses are custom made unless you choose to have a light adjustable lens, and even then there's some variance in that. So essentially, it's a little bit like going to the shoe store and picking out a pair of shoes that you would expect to fit, but you don't get to try it on. All of the testing that we do is meant to help us most accurately pick out a lens that's going to fit you best. All of the measurements that you'll have when you're with us, and of course all the information that we get from speaking to you will help us pick that lens out together. However, no person can be guaranteed an outcome, and we also have to talk about risks with cataract surgery as well. Cataract surgery is an extremely low risk surgery, but there's no way that I could ever tell you it was no risk. It's low risk, but not no risk. Cataract surgery is always going to have a risk of infection, just like any surgery, bleeding within the eye, retinal tears or detachments, or even the lens becoming unstable or dislocated. Because of that, cataract surgery ultimately will always have a risk of blindness in the eye or even loss of the eye itself. I know that can sound scary, but what I absolutely promise is that I would let you know if there was anything that I had to change during your surgery. Even if it was something small that I didn't think would make a difference, you would know before you ever left my building. At the end of surgery, if you hear me say, hey, that went great, you know it went just according to my plan, and at that point, we're just letting your eye heal up. It doesn't mean that nothing can happen after surgery. We are always on the lookout for retinal tears or detachments or infections, of course. You'll have lots of post-op instructions, and you're going to get an entire packet with lots of rules written down. But for me, I just want to make sure you wear the shield at night and that you don't rub it. Of course, you're always going to be on the lookout for anything to seem to go in the wrong direction. We want the vision to gradually get better and better, not worse and worse, and comfort should go from scratchy and kind of irritating to better and better. If there's anything that seems to go in the wrong direction, then of course we want to know about it, and we are on call 24 hours a day with a doctor from our practice.